Hello and welcome to Bottom Line. Fear of second wave on one side and enthusiasm over vaccine on the other, the COVID pandemic continues to draw attention nationwide and of course across the globe. Just when things seemed to be under control, a second wave in North India and other parts of the country has created concern of the same happening here in the Northeast. While everyone is eager to know by when the vaccine will hit the stands, another question that arises is whether the post-COVID complications are going largely unreported. To discuss the issue today, I am being joined by an esteemed group of panelists from Imphal. I am being joined by Dr. Nabakishor, Haobijam, Senior Consultant at Rajmedicity, a leading private hospital in Imphal. Dr. Haobijam is also the Joint Secretary of the Association of Healthcare Providers of India, Manipur chapter. A very warm welcome to you, sir. Dr. Rakesh Periwal, MD, Apollo Hospitals, Guwahati, is at the studios with us. Also in our studios in Guwahati is Dr. Satyaki Saikia, Consultant Internal Medicine from Axel Care Hospital. And in Shillong, from Shillong, we'll be joined by Dr. Prasenjit Biswas, Professor NEHU. Dr. Biswas has been very closely following, studying, monitoring the development in the vaccine front, has written a lot of articles on it. So a very warm welcome to all of you, sir. If I can go straight to Dr. Haobijam in Imphal. As far as the Northeast is concerned, there is definitely a concern in Manipur. As we all know, night curfew has been imposed in certain areas. There was a rise in numbers. A central team visited the state capital just recently. So how did things turn a bit critical again in Manipur? What is your assessment of things?
Currently, Manipur is not very in a very alarming state, but there's a little concern. We have a little bit increasing rise in positivity of the tests, and also there is an increasing trend of death rate. The case fatality is also increasing. So the scenario is not, at the moment, I would say not very alarming, but very concerning. And governments and all the stakeholders are doing their best to come to a sort of a collective effort to bring down the mortality of the current trend. And I feel things are going to go into a very more concerted effort than we have been seeing from last few months. And definitely things may improve after, say, 1 month or so. Even though there is a huge challenge of a surge in the December month, and which may even extend up to January. Till today, we have almost around 281 cases of deaths, and the monthly case fatality is a little bit increasing up to 1.7. It's coming up like that, even though the whole case fatality rate is around 1.1. But if we go by monthly wise, it is a little bit increasing, and there's a point of concern. And we all stakeholders are, trying to develop a concerted effort to manage that.
So what could have led to that, before I move on, what could have led to that slight increase when other Northeast states, we can safely say, are well in control? What do you think the recently held elections had something to do with it, or there are some other factors that could have led to a bit of an escalation in the situation in Manipur?
Yes, there are few major reasons. One is that the SOP, state SOP, even though it's very good, on the ground, it is not followed by our public at large, considering the gravity of the situation. And as you rightfully mentioned, there was some SOP which was not followed properly during the election times, which can also be a contributory factor. But overall, what I'm seeing is that there is a trend of certain phobia in the public, or rather fatigue also, pandemic fatigue also. They are refusing to test. They are refusing to come out with the contact histories, and they are sort of thinking that, staying in the home, even though when they are symptomatic, they feel that will save them. And when the symptoms progress to such an extent that it becomes, like he is not able to breathe or she is not able to breathe, then they come to hospital for consultation. That could be one of the major reasons which these things are going on. And I feel that our government and our all the stakeholders need to instill the faith that these kind of the challenges, pandemic challenges, cannot be faced by this kind of mindset. That means we have to taste more, we have to come forward, we have to be transparent about our context, and we have to know and isolate ourselves so that the spread does get contained at our community level.
Absolutely.
In Manipur, unfortunately, we have a little bit weakness regarding this, though even though all the stakeholders are trying hard.
Absolutely. Dr. Rakesh Periwal, not yet over, concern remains. Yes, situations, things have improved, but as we have seen in Delhi, what is happening in Delhi and some other places, and even to an extent in Mumbai, there is no room for laxity, and this phase is very critical again. Vaccine, yes, vaccine, when it will come, it's still very uncertain when we talk about the commoners. But again, this phase is very critical. We cannot still say the pandemic, the worst is over, is it?
Yeah, cases are pouring in. The good part is they are not very sick. This is one thing that we are really worried about, and we are very lucky to have numbers on our side. We still have availability of beds. That does not mean you can sit and let the disease spread. But yes, there has been a significant cut down in the number of cases, and that must be some kind of good housekeeping done by whoever agencies are involved. And we are always worried what we have seen elsewhere, but probably we are in one corner, sometimes that saves us. And maybe the movement of people is not that much that we see a second wave, and maybe the vaccine saves us. So we are keeping our fingers crossed. We are happy that we are able to deliver both COVID and non-COVID services because we are not overwhelmed. Most hospitals now, the scene is much better than what it was maybe 2 months back when we are rushing and running around for beds. And I have heard it from our government colleagues that it's getting better there even. They are shutting down some facilities. So we just hope that that doesn't happen here.
In fact, all temporary COVID care centers are being shut down. So the situation definitely has improved. But Dr. Saikia, again, very critical the next 2 months for the frontline workers, for the government, for all of us, for the public to maintain, to ensure the guard is not let down.
Absolutely. I think the worst, at least in Guwahati or in the state of Assam, we probably experienced the brunt of COVID in the months of July and August. And then slowly, I think from the month of September, slowly I think we noticed a little easing off. And I think anybody who's in the healthcare profession are probably seeing that the COVID beds are now not as much occupied as they were before. I think what you talked about Imphal, it could just be that their curve might be following a different trajectory. I think in every place it's different. It depends on how aware people are, if they're following the usual protocols. And I think it probably also has to do a little bit with the kind of care that we are providing. In Guwahati itself, I think people are now quite aware that masks work, that sanitizing works. I think this has been drilled into us. I do notice that even now there are some people who might have become a little lax as to using the masks. Maybe they think that this is over, the worst is over. But as we are seeing in other parts of the world, and especially in some cities in India now, that there is something called a second wave. There is actually, in fact, some people are calling it the third wave. And it's quite possible that it'll happen in Guwahati also. In fact, if you remember the last time around, initially the spike in cases were not very high. Then we had people returning from out of station. We had a lot of people who were trapped in other parts of the country, and they came back to the state, and that's when all the cases started rising. The situation is not as bad right now, but because there are so many people traveling from one part of the country to another, it's very easy for a third wave to start if we are not mindful about the basic things about this pandemic. We still need to wear our masks, we'll still need to sanitize ourselves, and we need to be careful about how we go about our business.
So basically, no room for laxity in railway stations, airports, bus terminals, that continues.
Yeah.
That continues.
Yeah, that has to continue. I mean, it gets difficult. There's a fatigue factor which is setting in, and there are people who have had the disease once and they think they can't have it again. So they are the one who have let the guards off. But let me tell you, there's nothing that reinfection cannot occur. We are still very early to tell about what the course of the illness will be even in a particular person.
Absolutely. Dr. Prasenjit Biswas, the government of India, the state governments, everybody seems to be talking about when the vaccine will be tentatively made available to the people, to the citizens, starting with frontline workers. How far are we still from a possible vaccine? How much more time could it take?
Yeah, vaccines are, most of the vaccines have already crossed over the 2 phases of trial. The important Mrna vaccine has made substantial progress. It has gone into the 3rd phase trial, as well as Minvax, the protein-based vaccine, also has gone into 3rd phase of trial. Even mRNA-based vaccine of Zydus Cadila has also gone into 3rd phase of trial. So the results that are coming, preliminary results, are above 90% success. So therefore, in the extreme case of COVID, the vaccine is working pretty well. And therefore, we have a lot of optimism on the horizon. And it is expected that by January itself, the commercial procedure for production of vaccine will begin, and then it will be possible to deliver, and the priority list is already drawn out. 30 crores of people who are above 55 or 60, and the health workers are the priority people to whom vaccine can be delivered. Therefore, I see a lot of hope in fighting this COVID at this point of time, and COVID curve is also interestingly flattening. Although there is a slight rise in last 2 days, but overall there is a flattening. The rate of recovery has gone much higher. Therefore, I am quite expecting that along with the vaccine coming soon by January and early February, and the curve flattening, it will be possible to really have a way out of the current pandemic crisis. The crisis, in a sense, is over, and that's the most important news today.
Absolutely. Dr. Haobijam, well, despite the fresh COVID alarm raised in Manipur, do you think, okay, even in Manipur's case, the worst is over? As far as the pandemic is concerned, the worst is over. Can that be safely said, despite there being a night curfew on and several restrictions coming back again?
No, I definitely think the worst is yet to come. It's a concerning situation in Manipur, but still I would say it's not very alarming, because all the stakeholders are being concerted, giving concerted efforts. I would also agree with Dr. Saikia when he says that our trajectory is a little bit different, because as I have studied some data of my COVID scenario, I have noticed that we have started community transmission from beginning of August onwards. So most likely, even if peaking occurs, it will most likely peak around end of December, or even we expect around January. So that is a situation looking at the epidemiological trend in our state. The only issue which my concern is that our testing capacity is not commensurate with whatever I feel is we'll be facing. So the authorities, I think, should take more concern towards that. And as far as our ICU preparation, as our COVID hospital preparation is concerned, we public and private, we have joined together. Like in Manipur, there is Caesar Hospital and my hospital, Rajmedicity, who are contributing to COVID block, and we have increased our beds. Caesar is managing around 50 beds, and we are managing around 34 beds.
Yeah, private hospitals
includes certain amount of ICU. Yeah,
private hospitals
so
pitching
the worst is
in.
yet to come, I feel.
Yes, private hospitals pitching in, which is a necessity, a great thing. I have to, but again,
definitely.
Again, Dr. Periwal, Dr. Saikia, if we talk about Manipur, for instance, if we see the last update, the last number of 135 cases in the last 24 hours, if we see a state like Manipur, it's not much of a difference from, say, a month and a half ago, 2 months ago, when we may have 150 or 200 or 300. It's not gone down to a 20 or a 30. Like in case of Assam, we had reached the zenith, say in August. August, September, when the numbers were really alarming. Now, of course, it has come down drastically. That again has not happened in Manipur. So, in Assam, do you think there's an advantage because there's a peak at, say, which covered a larger population who got infected by the virus? So, does that give Assam the advantage? And in Assam, at least, can we say that the peak is over?
Possibly. We can only go by the number of people who require institutional care. And as I said, the major concern actually remains of COVID going wrong. That we are seeing is happening less often. Even new cases, or there's a little bit of cases who are coming back again who have had COVID, what we call as post-COVID complications. Some part of that is also being catered to. But overall, I think the number of people who require institutional care has come down significantly.
Your take on that? Yeah.
Yeah, I think what happens is when the total number of cases shrink, the number of people that need or get very sick or get very serious also shrinks. So I think there was a time in July and August when the total number of cases were very high. And then I think people were getting sicker also, and a lot of people probably were delaying care. They were not coming on time. And now everybody knows that they need to have an oximeter at home. At least every person that I know, they all say that I have oximeters at home. I'm checking my O2 morning and afternoon. So they're all aware about what the possible complications can be and what they need to check out for. So anybody now who has a cough that is not getting better, anybody who's running a fever, anyone who's checked and found an oxygen saturation that is, say, below what is considered to be normal, even if they don't come in for a check, they call somebody. I have had patients call me and say that, should I come in for a test? Could this be COVID? So the awareness among the people is there now, which probably wasn't
I
true.
think that what helped probably, we came to know about COVID much early. If I talk about my hospital, we had a dedicated COVID area since March.
Yeah.
When we were just learning, because it was a policy of the hospital group that you should have it. And probably we managed our patients much better because we learned from our counterparts. If you look at the mortality rates in Europe, it was fairly bad with their kind of healthcare system. If you look at here, the mortalities have been really low. I mean, that's basically because we learned our lessons from outside. We got our testings done fairly early. I mean, RT-PCRs getting here in a private lab, that was something we couldn't have believed would happen. And if you look at the testing rates now, we are actually capable enough of doing even more than what we need. That probably helped us a lot. Those 3 to 4 months of lull before we actually got into cases and then peaked, we were already prepared. Most hospitals had 20, I have a 20-bedded unit dedicated to only critical care in COVID, which is a fair number of beds for a small hospital. So I think that really helped, and what really helped was we got everything late. Hopefully we wash out the second wave just because we have learnt it well.
Yeah, I think so. I mean, at least when I talk to my friends in other parts of the country, the way I think as a community Assam has dealt with COVID is actually quite exemplary. I think the amount, probably some you guys have, some credit to bear because of this, because you made people aware and people knew what the disease was.
The health minister has been so proactive. We have to give it to him also, on the ground himself, everywhere from GMCH to the quarantine centers, and that has an impact when you have the minister going there personally, despite the risks in place. So that helps big time as far as creating awareness.
Even medications, when we use, because there was a huge shortage of antivirals, remdesivir, or even some of the newer monoclonal antibodies that we're using. But we always found a way to get it. It was never as if the patient is there, needs it, and we couldn't get the medicine, and that's why the patient succumbed. That never happened. We always managed to get the medicines that we needed. So that, I think, is that says a lot about how it was managed in the state. So.
Dr. Haobijam, I'll come to Dr. Prasenjit Biswas, but before that, Dr. Haobijam, well, once again, we have some restrictions in place in Manipur, but from our experience of the pandemic now, can we safely say that what is required is for people to maintain the protocols? Restrictions as such do not help. Imposing a curfew, lockdown doesn't make much of a sense right now. Dr. Haobijam, what is your take on that?
I definitely agree with what you have just said, because I don't think restrictions and lockdowns is a solution now. What we need is the public to come to a full awareness of what is the pandemic, and they should have a pandemic mindset now, and whatever is being said in the state SOP is what we need to do. It's very disheartening as a frontliner, to notice our people still disregarding the SOPs. They're not wearing their mask properly. They're not even not taking more awareness of how to put on the mask and wear it properly also. So I think this will come up as behavioral changes take time. But as a frontliner, it's a little bit exhausting, or rather alarming that they are not taking this up with the, what do you call, gravity it requires. And like to tell you very frankly, to decrease the number of positive cases in Manipur, it's not us healthcare workers, or it's not even the role of the government. It's rather the public. If we maintain the SOP and all, and if they care about each and everyone's safety, the positive cases will come down drastically. And I really appreciate hearing about the Assam, the trains and all. And I feel that's mostly due to because of the increasing awareness of the people and the mindset towards the pandemic. So we're trying hard to impart this message to our public. And few of the publics are coming up, but I don't think as a whole, as a state, as a collective, we are still yet to come into the pandemic mindset that each of us has to contribute to decrease the death rate, to decrease the positive rate. And people are still yet to digest that our death rates are increasing. And because they're refusing to test. They're refusing to come forward with information that they're infected. And we find that, some whole of the families getting infected. These are the scenarios.
Absolutely.
So, but we feel that all of our stakeholders in Manipur, we are trying very hard to come up and to get along with the public and bring towards more positive changes.
Dr. Prasenjit Biswas, is complacency creeping in somewhere now that the situation has improved a bit? But we very well know there's no room for complacency. We all can see, it is for us to see what is happening in Delhi again. The situation is once again alarming. But probably, as Dr. Haobijam mentioned, is complacency creeping in somehow in the northeast with the numbers going down, and that shouldn't happen in any case.
Is it to me, Nabarun?
Yes, Dr. Biswas.
Hello?
Yeah.
Okay. Yeah, sure. So the story should be like this, that there should be abundant caution at this point of time. Just because we have successfully flattened the curve in certain places and vaccines are awaiting, should not allow us to lower our guard, as others have spoken out. But the local medical facilities have to be augmented. They have to be made much more efficient to respond to crisis calls. There should be proper supply of oxygen. There should be proper supply of medicine and delivery of medicine at the right time, along with the quarantine procedures, which have to be monitored by a team of expert doctors. In fact, in the state of Meghalaya, the quarantine procedure is working pretty well. And in the testing procedure, there are some new ways of doing testing at this moment. The test kits have improved. The reading capacity of the test kits have improved tremendously. And this is also a major source of hope, because we can remove the false positives and we can really come to terms with the actually existing cases. And then we can also identify the way the cases can transmit in a certain area. Therefore, there are now better ways and means to tackle the disease, but we cannot lower our guards. We have to be with abundant caution all the time.
Absolutely. We have to go for a break, but before that, I'll quickly go across to Dr. Haobijam. Well, as we speak, there are again close to 3,000 or more active cases in Manipur. How is the pressure like in the hospitals, be it the COVID hospitals, the RIMS, the Janims, or even some of the private hospitals?
Yeah, fortunately, our people are opting for home isolation. There was a initial resistance to home isolation, but currently the acceptance and compliance towards home isolation is increasing. Roughly about 40 to 50% of the active cases are now being managed in home isolation. So relatively, we are little bit relieved of the pressure. But having said so, the beds are still full, and the come about vacancy means very, it's very rare, I feel say. For per day, the vacancy come around 4 to 5 in total this thing. So it's a little bit hard, but all of the stakeholders are trying to, sort of increase the number of beds. RIMS and Zenins facilities, government is trying very hard to increase the number of beds and increase the number of ICU beds. Because we expect that these pressure is still going to go up as we see that the deaths have started occurring from July onwards. So we feel that along with the picking trend, the death rate will also pick up, even in spite of our most of the efforts, and especially since the patients, they are refusing to come into time. That is one of the factors which we are facing right now. So at the moment, the beds are okay, but we are trying to increase the capacity.
Constant pressure on the frontline workers in Manipur. Still, we have to go for a very, very short break here. Stay tuned. Welcome back. You're watching Bottom Line. We are discussing the COVID scenario in the Northeast. Post-COVID complications, much talked about, but still a lot of it may still be going unnoticed. Dr. Rakesh Periwal, post-COVID complication is something, it ranges from individual to individual. There can be different complications. For our viewers, now the focus is mostly on post-COVID complications, the kind of situations, health situations that people face. A lot of cases are there. There are also a lot of rumors. There are speculations. So I'm sure our viewers would like to know what are the common complications that you may have experienced or you may have heard of, come across some of them, and how critical or how dicey, how twisting can things get?
The complications post-COVID, I mean, we haven't seen too much time post-COVID, but we can call it peri-COVID kinds, immediately after recovery. One of the major problems is the clotting issues which happen in the body, leading to stroke and heart attacks. And that we have seen even within the hospital, patient recovering and then having some cardiac complications or a stroke, losing lives even. That is one part. And the other part is probably the lung itself, how badly it's get damaged. So you may continue to live, but you may not have productivity. Your oxygen levels may still be low for you to be requiring oxygen at home. Those with pre-existing lung, they are doing badly because they have worsening of lung function. The kind we haven't seen with other viruses. We generally expect kind of full turnaround. That is one part. And the other part has been fatigue. Something which we call as chronic fatigue syndrome, we have known with other viruses, but in this case it has been fairly dramatic. People haven't been able to join back work. I know colleagues of mine who haven't been able to come back to work because they are having intense fatigue, not only physical fatigue but mental fatigue even, inability to concentrate, judge. That is one part. And the other part is the psychological impact of COVID. People getting displaced, they're having long hospital stays and bills, losing businesses, the kind of tough situation economically. So you can see, and families, bereavement. Sometimes there is kind of guilt even, where the disease has passed on from the younger one to the elderly, and they feel like, oh, did the virus go to my parents from me? So we see patients who have a lot of psychological burden, the family men, even the caregivers, the constant fear actually of living even with the post-COVID patients, how long they are infective, how long we isolate. So fairly difficult, and the behavior of the virus is something which we are learning every day. So we might have long-standing complications. We have had viral infections before, like herpes, where complications occur after decades. And we have heard people talking, could it be with COVID, where it reactivates in your body again? Maybe you develop complications maybe months or years down the lane. So our learning curve is very small, But what we have seen is majority of the people, the major problem is cardiovascular complications and stroke.
Sounds quite concerning. Dr. Saikia, your views?
What I noticed was that I now, at least as far as my patients are concerned, this is what I tell them, that COVID, I think, has two parts. It's an illness with two parts. One is a very predictable part, where the virus comes in, it infects you, it does what it's supposed to do, you get your symptoms, you get a little fever, you get your body ache, and then the virus goes away. Predictably, the virus usually goes away between 10 to 12 days. In some people, while the virus is still in the body, it can affect your pulmonary system, meaning your lungs, to some extent. In some people, it doesn't do a thing. You just get better and it's as if nothing happened. In the people where the lung does get involved, you might recover very fast, or you might linger on for a longer period of time. And this is where what Dr. Periwal was talking about is what we call a COVID-related pneumonitis. Pneumonitis meaning inflammation of the lung. So the theory right now is that these dead viral particles might remain in your lung tissue, and it actually stimulates an inflammatory reaction that happens in the body. This is not done by the virus. The virus is already dead and gone. But even after the virus is gone, the body's inflammatory system actually keeps it perpetually going on. So there are people who have recovered from COVID, who get discharged from the hospital, go home, return a week later, completely out of breath with lungs that look terrible. Or we have had people who had no idea they had COVID. They were never tested. And they first present to the hospital, they get a CT scan and it tells them that you have COVID. They do a test and the test is negative. And then there's a confusion as to, if my test is negative, how can I have COVID in my lungs? And this happens because these people had COVID at some point in time, and they're developing this post-COVID inflammatory pneumonitis. This is something very different from other viral pneumonias. Most viral pneumonias, when you get them, once the virus goes away, the pneumonia gets better. It's in COVID that we are seeing that there is this inflammatory reaction. Not only is there inflammation, the CT scan actually calls it fibrosis. Fibrosis, by definition, is generally a term that happens, it takes months or years for it to happen. In COVID, we see these changes within a period of days. So initially, at least as internists, me as an internal medicine physician, I couldn't believe that fibrosis could be happening. And we used to argue with the radiologists that how can it be fibrosis if it's been just going on for 7 to 10 days. But that is exactly what the process is. And we have found that newer anti-fibrotic medications, when we use them, they actually cause resolution of some of these symptoms. And the reason why I'm telling you this is because if any of you have had COVID, or a COVID-related illness, or your family members have had it, and you are suffering from a cough that doesn't get better, you're getting oxygen levels that are still low, you're having unnatural fatigue, you're finding that it's difficult for you to work, please get yourself tested for COVID-related pneumonitis. This disease can actually be measured. We do a CT scan, we can actually see whether it's mild or moderate or severe, and depending on the condition, we have medicines for it now, and these medicines will work only if we start them early enough. The blood-related complications that Dr. Periwal was talking about, there is a particular test. If you have had COVID, you're probably getting this done repeatedly. It's called D-dimer, which actually shows the level of a particular protein in your blood. And this D-dimer level can go very high in COVID. And for a lot of people, even after they get better, the D-dimer doesn't come down or doesn't become normal. And there's a lot of concern that there might be something going on in my blood. Am I getting a blood clot? Not so. Even though we follow this level during the illness, we actually treat it. But in post-COVID situations, sometimes D-dimer may take months to come down to normal. So please consult a physician. There are medications you may need to be on till it becomes normal. But by itself, it does not mean much when you have recovered from COVID. But post-COVID pneumonitis is a real thing. It can be treated. It's affecting a lot of people. So please don't take this lightly.
Absolutely. Dr. Prasenjit Biswas, do you think there is enough awareness about what we call the post-COVID complications, how serious they can be? Are people aware that they should be on the watch as far as their health is concerned if they have suffered from COVID?
Yes, awareness about post-COVID care is somewhat slack at this point of time. And we can see a lot of patients are complaining about serious persistent symptoms like breathlessness, blood clot, and various other kinds of cough and other symptoms. In all these cases, proper medical care needs to be ensured, and depending on the symptom, COVID centers have to develop a post-COVID care procedure. Although Ministry of Health and Family Welfare had issued a protocol about post-COVID care, which includes psychosocial aspects of the post-COVID situation, to take help from community-based self-help group or the peers, but these things are not brought into practice in the northeastern region, especially community-based palliative care in the post-COVID symptoms have to be augmented. It is to be augmented both by the medical practitioners as well as by paramedical staffers, and this requires a separate set of protocols to be implemented on an urgent basis. This also is an emergency situation of treating post-COVID symptoms. Therefore, all emergency care needs to be ensured for post-COVID symptomatic cases, including psychosocial disorder that comes through the COVID stress. So one should also have post-traumatic stress disorder management systems in place. If we can ensure all these systems in place, it will be possible to develop a greater awareness and attention for post-COVID symptoms in northeastern states, which is absolutely necessary in this kind of a situation today.
Absolutely. Before I go to Dr. Haobijam in Imphal, Dr. Rakesh Periwal, you mentioned how complicated things can be. Have you seen surprising cases in when you talk about post-COVID complications? Normally healthy person also may develop some severe complications, especially when you talk about fatigue, forgetfulness maybe, and breathing problems. Have you seen such symptoms also in people, individuals who have been perfectly healthy before COVID, pre-COVID? Has that also been the case? That is something which I am sure a lot of our viewers would want to know.
Yeah, fatigue is one thing which definitely is all pervasive and something which has been actually disabling, so much so that you are not able to get back to your life that you had been in. That is one part. And the other part, as we can see, is the elderly people with the comorbidity, what happens to them. And it's easy to say, but the drug load increases. Think of someone who has cardiac disease, he is on 2 blood thinners, antiplatelets, and then you take an anticoagulant. So there are issues about drug related problems as well in those patients. Caretaking for them, taking health care in this critical situation. We always worried what will happen to our non-COVID patients. Luckily, we went through that. But there are indirect impacts also of COVID on the overall healthcare delivery systems. And regarding the post-COVID issues, we are seeing that, as Dr. Saikia said, even in people who did not know that they have had COVID. And people who have had COVID had an absolutely uneventful first 2 weeks. They became negative, and thereafter they had breathlessness and other symptoms. And here I would say is people should not have fixation about them being negative. Many people ask me, have my test become negative? Oh, that has no implication. It is an epidemiological concern, whether you are shedding the virus or not. But that does not mean you have recovered and you have won over the virus. Oh, it's good news to be negative, but it does not mean you cannot have post-COVID complications. So that should be borne in mind, that your negative or positive status does not define that. But probably COVID sets in something in the body, something which is unnatural, and with over these months can damage your organs. Maximum damage, I said, if you look at the numbers, probably the neural function, mainly in terms of fatigue and forgetfulness, and the other ones is the heart and the brain. But one good thing is that we are not seeing other virus illnesses, and I think mask is helping, because we are actually seeing much less number of normal pneumonias that we used to see in our ICUs. Those incidences have come back, COPD exacerbations, people who had pre-existing lung disease coming for care. Maybe the air has improved a little bit, but that is the good side to COVID, that these mask behaviors may actually remain. And these might be recommendations we give now.
So you are
to
saying
our
masks
patients.
are
Yes,
here
help.
to remain, and they should
Yeah,
remain?
and should maybe.
Should remain.
People who have existing
There are
medical...
also studies which say, okay,
Yeah.
they may have permanent impact on the lungs as well.
Oh,
what about
But I feel like mask will be something which will be in. We had seen people wearing masks, the post-transplant patients on immunosuppressive drug, and it used to look odd. And that was the reason people did not feel comfortable wearing them. at least not in community, you can see in hospitals. Now it's not odd anymore. It's not a social taboo kinds that he is wearing a mask. It looks good. And what we are seeing is, see, the mask helps you with particle size. They were actually meant for small particle size. And luckily, all the bacteria are much larger than the size of this mask than filter. And we have had advices given, when we clean our houses, we generally put that hanky around our nose. It helps. We know that. So it has helped in allergic disorders, it has helped in infectious disorders, and I think mask is helping tremendously in chest-related disorders and decreasing complications.
Right.
So that's a good part of it.
Yeah, we have been joined over the phone by Dr. Nabajyoti Gogoi from Dibrugarh. Dr. Gogoi, welcome to Bottom Line. Well, things have improved a lot since we spoke the last time. You have been at the helm of affairs in your hospital, the medical college. You have seen it all. Do you think things are very much under control now as far as the COVID situation is concerned?
Good evening, Good evening. I can hear you very little bit. Anyway, I was not in the previous conversations as such. What was happening, but as you have asked me, the situation out here in Dibrugarh has came under very much control. We had everything going on, epidemiological data we have been collecting all throughout, and we have been analyzing it all throughout on daily basis, where we have found it will rise in the month of July and it will come down in the month of October. As luckily as it happened, and we have come down to about 13 to 14%. We had positivity rate at one time. Now we have come down to 1.5, and sometimes in Gogoi, in some places 0 even. So that's a very good news. The thing is that right now, whatever is happening is about, I say about the second wave or third wave. I've got a little bit to say about all this when we have studied the situation. Our hypothesis in an epidemiology, it says that about when the 40 to 50% of the people get infected, the curve really comes down. And we hope so. We have been planning to go for a serological survey in Dibrugarh. We have already submitted a project for the serological survey, whether the second wave or third wave will come or not. And that has been approved. We will be going in very shortly, within a week or so. And we'll be expecting good news on that too. And thing is that whatever is happening right now, that we are seeing an increasing number of cases in airports and railways, especially in airports. People, those who are in Delhi, in Tamil Nadu, in Calcutta, from where they are coming in, they are found positive. Suddenly, we have got a rise in number of cases in last week.
Okay.
So that is there. But thing is that we should know whether our people are already immune to that or not. There are a lot of questions regarding all that. We'll have to look into all those aspects in epidemiology. But
so all in all, we cannot lower the guard as far as airports, railway stations are concerned. Dr. Gogoi, very quickly, we had also been discussing post-COVID complications. How much of that did you see in Dibrugarh, the post-COVID complication scenario? Very quickly.
Well, see, post-COVID complications are like that. The lethargy is one of the factors that should be concerned. There are a lot of other extrapulmonary COVID complications. Are very dangerous, and pulmonary complications are there too. But thing is that, but if you look into the lethargy, if you don't do a study, what we are lacking is the study, ongoing study. We need to go for what I would like to suggest here as epidemiologists. We need a real time study of the whole of India. What's really happening? That should come out very true. And post-COVID lethargy is one of the most bad symptom that might affect the country, that might affect the workforce of the country.
Yeah, what I also wanted to ask you, my last question, have we seen people flooding hospitals with post-COVID complications in large numbers, sizable numbers? Have you witnessed that? Has that been the case?
There are not as much. With the easternmost township of Assam in the northeast, in Dibrugarh, we had about more than 14,500 positive cases out of 13.5 lakhs people. So that's quite a number. But thing is that there are more. If you look into that, one person can infect about 40 individuals in 8 days. That's the calculation. So we must be having more than about, suppose there more than 40 to 50,000 of the 40% of the people are infected. That's why we are getting our curve down. That's a huge number, and that if the percentage of the people, those who are suffering from COVID lethargic syndrome, and that might affect the workforce of the country. That might leave an impact on the country.
Thank you so much.
economy and-
Thank you so much, Dr. Gogoi, for your inputs. Dr. Nabakishor, Haobijam, it's said that in the Northeast, especially in the other states, the other 6 states, people have a very healthy lifestyle. Do you think that also plays a role as far as the post-COVID scenario is concerned? How do you see it in Manipur, for instance? There have been over 25,000 cases in Manipur as well. How is the post-COVID scenario there? Has it been better, not so critical maybe? As in, though it's still early to say, as Dr. Periwal here just said, it's too early to say, to understand the post-COVID complications. But still, till now, what has been the experience?
I agree with Dr. Periwal that it's too early. In fact, if we go by our experience also, at our private setup, we have just started managing COVID patients from last month only. So it's too early to comment on how will our people in Manipur will respond as COVID complications, because as far as I know, we had some popular misinformation going around that we have a lot of UV ray exposure and we eat a lot of fermented foods and we have certain our cuisines are protective and blah blah blah, so and so, which are not coming true. And I feel, as far as the global scenario is concerned and our Indian experience is concerned, we'll also have that kind of similar thing in Manipur. And I don't think that we'll be more, resistant or immune to that. And because I'm not seeing those trends seeing now. And looking at the death rates which are coming about, it's almost the same pattern which is seen in the whole world over and in India. The comorbids are also dying, and even young aged people who are even without comorbids, they're also dying. And the things that with the little bit of complacency going around and with the non-challenge which is going around, things may go into a very different alarming way.
Absolutely.
Absolutely. So, as I said earlier, it's too early to comment on
basically
that.
Basically, the virus is behaving the same everywhere.
Long COVID and all.
Yeah. Dr. Saikia, the vaccine, coming back to the vaccine.
We are preparing for that.
Yeah. Can we say the vaccine is here till the time it is not here? I mean,
no, we can't.
There's a lot of slips between the cup and the lip.
And not just in the preparation of it. I mean, the deadlines that we hear, or the numbers that we hear, that it'll be ready by January or it'll be ready by June. There are 3-4 different vaccines that are being developed. 3 very popular ones. One, a locally made vaccine we have in India now. So these targets that they're giving us is when the vaccine will be ready to be deployed. That does not mean the next day the entire population is going to get the vaccine. It is going to be a massive logistical challenge to actually get this vaccine to the people who need it. So just getting the vaccine ready or approved does not mean people have the vaccine. So we can't really celebrate the success, right now. The second thing is that as far as the vaccine is concerned, the 3 major vaccines that we are seeing till now, one, we have the AstraZeneca, the Oxford vaccine, we have the Moderna vaccine, and then we have the Pfizer vaccine. So 2 of these vaccines are mRNA vaccines, and the AstraZeneca Oxford vaccine is a DNA vaccine. We have never had mRNA and DNA vaccines made till now. Till now, we have always taken a piece of the virus, or we have taken an inactivated virus, or a live attenuated virus, a weak virus, and we put it into the person, and we hope that that person will react, the immune system will react to it and make antibodies to it. This time, we are going about it in a very different way. We are actually extracting, or we know the Chinese have actually told us what the genetic material of the virus looks like. So we have actually taken that genetic material and we have formed a molecule called an mRNA that actually makes proteins in our body. So we'll be injecting the mRNA that will be taken up by our skin cells, and the skin cell will signal our own body to manufacture what will look like a viral particle. And it is in response to that viral particle that we'll develop the immunity. So it's kind of a roundabout way of doing this. The benefit of this is that we can actually scale up production really fast, and the production time is much lower than the conventional vaccine. And the other thing is that for the mRNA vaccines, the shelf life, to store it, you need very low temperatures. Whereas the DNA vaccine that AstraZeneca is developing, you can keep it in a regular fridge. So transportation will be a lot easier, for the DNA vaccine. But interestingly, the DNA vaccine, when they tested it, they found that the efficacy was only about 60%. And in UK, where by some kind of an error, they actually gave half the dose in the first shot, and they gave a full dose in the second shot, the efficacy was 90%. So it was simply by error they found that it can be 90% when they actually use less, the first time around. So now in the other places where they're actually running the trials, they're cutting down the first dose by 50%. So in other words, what I'm trying to say is that we don't really know how the vaccine will behave. We don't even know properly what dosage we need to give to get the best response. So to plant our hopes on a vaccine that is going to come and save all of us is probably a little bit, early.
Very, very interesting observations. Dr. Prasenjit Biswas, last remarks from you. We're running short out of time. The way forward from here.
Yeah, as far as vaccine is concerned, I think my preceding speaker has summed up the situation very, very well.
Absolutely.
Nevertheless, I would say that mRNA vaccine success rate is higher than the DNA vaccine success rate at this point of time. And there is a greater chance that the mRNA vaccine is going to arrive, especially Zaidus Cadila or our Covaxin or even Moderna's vaccine, or even Sputnik. Any one of them will definitely be arriving and will get prepared in our country, and therefore we will be able to tactically use these vaccines in order to cure the extreme cases of COVID-19 and also diagnose the early diagnosis of the post-COVID symptoms will be possible. And once early diagnosis happen, then there could be lesser dependence on steroids, and there could be greater study on the side effects of the steroids by which the post-COVID symptoms can be cured. So therefore, the entire ecosystem requires a little bit of reorganizing itself, refurbishing itself with the new fact and new ways of managing the situation.
Absolutely.
And I'm sure
I'm completely
that, with the
running out of time.
The entire medical fraternity, it will be possible to manage
Absolutely.
it.
Last words, Dr. Periwal, parting remarks.
Yeah,
very
everything
quickly.
in this virus timeline has been very, very dramatic. November, the first case. By January mid, you actually have the structure. By January end, you have warnings of the pandemic. There's a pandemic which happens in March. There's a vaccine which starts developing in a year. Everything has happened in 1/10 of the time. So I'm hopeful that we will have the right vaccine also arriving.
Absolutely.
Maybe at 1/10 of the time.
We live in constant hope, but all in all, well, we have to follow the safety protocols. That's our best bet for now. Thank you, everyone. Thank you, Dr. Haobijam. Thank you, Dr. Saikia, Dr. Periwal, Dr. Prasenjit Biswas. Well, stay safe. Take care.